Hello guys, welcome back to Medicodays. So today in this video we'll be discussing the remaining questions of FMGE JAN 2025 session. But before moving on to the details of this video, I would like to announce to you all that our Neetpg 7 years QBank PDF book is available at a very nominal price and it's completely ready. And if you guys are interested, you can buy them through the link provided under the description. And we are trying to prepare a similar book for FMG and other competitive exams as well, but it'll take some time. So currently moving on to the details of this video. First question: an HIV positive man presents with high grade fever, positive Kernig sign, and CSF showing reduced glucose, increased protein, and increased leukocytes. A diagnosis of cryptococcal meningitis is made. What is the appropriate management? Answer is liposomal amphotericin B plus flucytosine. It is a first-line induction therapy for cryptococcal meningitis in HIV patients as per the World Health or IDSA guidelines. This regimen achieves rapid fungal clearance via synergistic fungicidal activity, and it reduces mortality and intracranial pressure, which is common in cryptococcal meningitis. Next question is from microbiology. What is the mechanism of action of botulinum toxin? Answer is it prevents the release of acetylcholine. So this question can also come from pharmacology as well. So botulinum toxin, which is produced by Clostridium botulinum, cleaves the stere proteins, soluble NSF attachment protein receptor, essential for vesicle fusion at the presynaptic nerve terminal. This disrupts the exocytosis of the acetylcholine into the synaptic cleft, thereby preventing the neuromuscular transmission. Next question from PSM. Out of 2000 patients assessed for HIV, 200 are confirmed positive. A new ELISA test identifies 260 positive cases, but only 130 are true positives. What is the specificity of this test? So the formulas for sensitivity, specificity, positive predictive value, negative predictive value, all these are very important. So specificity is calculated by true negatives plus false positives into 100. So the formulas, please go through all of them, and sensitivity, specificity, positive predictive value, negative predictive value, all these are very important, guys. Please learn about them. So here when you apply the formula and put the values, it will come as 93%. Next question is from PSM. Which health program does the Danish International Development Agency, Danida, support in India? Answer is blindness. So Danida, Danish International Development Agency, collaborates with India primarily on the National Program for Control of Blindness and Visual Impairment. Next question is from biochemistry. Which substance is excreted in the urine of a patient with essential pentasuria? Answer is L-xylulose. Essential pentasuria is a benign autosomal recessive disorder caused by the deficiency of L-xylulose reductase, xylitol dehydrogenase, in the uronic acid pathway. This leads to the accumulation and urinary excretion of L-xylulose, which is a pentose sugar. Next question is from physiology. A person is performing weightlifting and attempts to lift the dumbbells overhead. Which of the following changes will be seen in the sarcomere during this process? Answer is I band decreases because during muscle contraction, example weightlifting, the sliding filament mechanism shortens the sarcomere, and the I band decreases due to increased overlap with myosin filaments as actin slides towards the sarcomere center, and the edge zone shortens, but it is not listed in the options provided here. So I band decreases will be the appropriate answer in this case. Next question is from pediatrics. A child presents with a single palmar transverse crease and low set ears. Which genetic abnormality is most likely? Answer is aneuploidy. A combination of single palmar transverse crease, which is also known as a simian crease, and and low set ears, they are the hallmark features of Down syndrome. Trisomy 21, which results from aneuploidy, an abnormal number of chromosomes, especially 3 copies of chromosome 21. Next question from pediatrics. What is the appropriate timing for blood sampling to diagnose neonatal hypothyroidism? Answer 72 hours after delivery. So blood sampling at 72 hours avoids the physiological neonatal TSH surge, which peaks at 30 to 90 minutes post-birth and normalizes by 48 to 72 hours. Early sampling, which is at less than 48 hours, yields falsely elevated TSH, risking overdiagnosis. Next question: a 45-year-old healthy man presents with minor rectal bleeding and a family history of colon cancer. Father was diagnosed at 56 years, and his physician recommends colonoscopy. Which level of prevention does this represent? Answer is secondary prevention. It aims for early diagnosis and treatment. So, in asymptomatic or minimally symptomatic patients to enable the proper intervention. And colonoscopy screens for premalignant polyps or early stage colon cancer in high risk patients, that is who have family history and also bleeding, aligning with this level. Next question is from microbiology. A patient's lab result is positive for typhoid with Vidal test findings of O antigen 1:20, H antigen 1:380, A antigen 1:20, and B antigen what is again 1:20. What is the most appropriate stage of this disease? Answer is reconvalescence. The isolated elevation of H antigen with minimal O antigen and low paratyphoid titers indicates the reconvalescence, that is the recovery phase of typhoid fever. Next question from microbiology. An organism cell wall contains lipoteichoic acid, a peptidoglycan layer, and plasma membrane. Which organism matches this description? Answer is gram-positive organism. Again, the cell wall of gram-positive and gram-negative, again an important topic. It's a very basic question also. Please don't make such questions wrong in the exam. Next from biochemistry, a baby presents with chronic diarrhea and rashes on the genital region. And what is the most likely deficiency associated with this condition? Answer is zinc deficiency, because the presentation of chronic diarrhea and perianal or perineal rash is characteristic of acrodermatitis enteropathica, which is caused by zinc deficiency. It is caused by a mutation in the SLC39A4 gene, and it leads to impaired intestinal zinc absorption, leading to systemic zinc deficiency. It is essential for epithelial repair, immune function, and enzyme activity. Deficiency disrupts the gut mucosa integrity and skin barriers. So what are the rash features? There will be symmetrical lesions in perineum, perioral area, and also in the extremities. That is, there will be an acral distribution. Next question from surgery. An elderly patient presents with an ulcer on the medial canthus featuring pearly rolled margins. Histopath reveals nesting cells with peripheral palisading. What is the most likely diagnosis? Answer is basal cell carcinoma. It is characterized by pearly rolled out margins and telangiectasia because of the translucent tumor stroma reflecting light. Nesting tumor cells with peripheral palisading is seen in basal cell carcinoma on the histopathology. So all this points towards a case of basal cell carcinoma here. Next from biochemistry, a chronic alcoholic patient with reduced food intake over the past few months presents with hypoglycemia. Most likely cause of hypoglycemia in this case is impaired gluconeogenesis. Chronic alcohol consumption leads to excessive NADH production during ethanol metabolism, which shifts the metabolic pathways. Key substrates like pyruvate and oxaloacetate are diverted from gluconeogenesis, impairing the glucose production. The patient's reduced food intake exacerbates the reliance on gluconeogenesis for glucose, making them vulnerable to hypoglycemia when this pathway is inhibited. Next question from pharmacology. Which adverse effect of bleomycin can be reversed by radiation therapy? Answer is pulmonary fibrosis. So bleomycin induces pulmonary fibrosis by generating the free radicals via iron-oxygen complex, causing DNA damage and inflammation in the lung tissue. Radiation therapy synergistically exacerbates this damage by further injuring the pulmonary parenchyma, leading to progressive fibrosis. So patients may present with dyspnea, dry cough, or restrictive lung disease. The risk is dose dependent and heightened with concurrent radiation. Hepatotoxicity is rare with bleomycin, and it primarily affects the lungs and skin, leading to flagellate dermatitis. Next question from pathology. A 45-year-old woman with a history of long-standing goiter presents with a solitary thyroid nodule. Histopathological examination reveals nest of polygonal cells and pink eosinophilic extracellular material. Most likely diagnosis is medullary carcinoma. It arises from the parafollicular C cells which produce the calcitonin, and it is characterized by nests of polygonal cells and the amyloid stroma, which appears as pinkish eosinophilic material which is formed by the calcitonin deposits. Next question from biochemistry. Which substrate accumulates in type 9 mucopolysaccharidosis, which is also known as the Natovic syndrome? Answer is hyaluronic acid. So MPS 9 or the Natovic syndrome results from a deficiency of hyaluronidase, the enzyme responsible for degrading hyaluronic acid. This leads to hyaluronic acid accumulation in tissues, causing joint stiffness and soft tissue masses. Mild skeletal abnormalities, joint involvement without significant cognitive impairment is seen, and normal life expectancy distinguishes this Natovic syndrome from other MPS types. And so moving on to the next question. From biochemistry, which hormone is primarily produced during starvation to regulate and maintain blood glucose levels? Answer is glucagon. So during starvation, low blood glucose triggers the alpha cells of the pancreas to secrete the glucagon, and it activates glycogenolysis and gluconeogenesis, finally leading to release of glucose into the bloodstream. It simultaneously inhibits the glycogen synthase, preventing glucose storage. Next question from microbiology. A 4-year-old boy develops bloody diarrhea and abdominal cramps. Bacteria isolated from the stool specimen ferments lactose and produce colorless colonies on sorbitol macaque agar. Most likely agent is Shiga toxin producing E. coli. So Shiga toxin producing E. coli O157H7, a type of EHEC, produces Shiga toxins, damaging the intestinal endothelial cells and causing bloody diarrhea. Unlike most E. coli, it does not ferment sorbitol, resulting in colorless colonies on sorbitol macaque agar. Low infectious dose enables fecal oral transmission, often linked to undercooked beef or contaminated procedure. Next question. During a forensic examination, a skull bone with a cephalic index of 85 was analyzed. Which race does the skull most likely belong to? Answer is Mongoloids, because the cephalic index calculation is by the formula maximum skull breadth by maximum skull length into 100. An index of 85 classifies the skull as brachycephalic, 80 to 84.9. And there are different categories based on the cephalic index calculation. Brachycephalic skulls, they are typical of Mongoloid populations, example the Mongolian Chinese. Dolichocephalic skulls will be having a value between 70 to 74.9, and they are associated with Negroes and poor Aryans. And mesatecephalic between 75 to 79.9 are seen in Europeans and Indians. Next question from forensic. Magistrate inquest is done in which of the following circumstances? Answer: death due to police firing, governed by section 176 CRPC and BNSS 196. A magistrate inquest is mandatory for unnatural deaths involving state authorities or custodial situations. So it is conducted for deaths because of police firing, lockup deaths and custodial deaths, prison deaths and alleged dowry deaths. It ensures independent investigation to maintain transparency in cases involving law enforcement. Next question from PSM. A total of 60 patients were diagnosed with COVID-19, out of which 12 deaths were reported. What is the calculation of the case fatality rate? Answer is 20%. So the formula for case fatality rate is number of deaths by total diagnosed cases into 100, and if you put the values into it, then the answer will be 20%. It measures the disease severity by quantifying the proportion of fatal outcomes among the confirmed cases. Next question from pathology. A patient is suffering from a rare disease with mitochondrial inheritance. This can be inherited from which of the following members? Answer is mother. Mitochondrial DNA is inherited exclusively through maternal transmission. The ovum contributes mitochondria to the zygote, while sperm mitochondria are degraded after fertilization. An affected mother transmits the disease to 100% of her offspring, both males and females, but an affected father can only transmit the mitochondrial disorders to any of his children. Examples are Leber's hereditary optic neuropathy, and MELAS, which is a mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. So next question from anatomy. After a roller coaster ride, a patient experiences a brief sense of imbalance before standing upright. Which tracts help maintain balance in this situation? Answer is vestibulospinal tract. The vestibulospinal tract originates from the vestibular nuclei, that is pons or medulla, and descends uncrossed through the spinal cord. It activates the extensor muscles and inhibits flexor muscles to maintain postural balance during movements like roller coaster rides. And the pathways, it receives input from the inner ear, vestibular apparatus, and cerebellum, integrating sensory data for equilibrium. Next question from FMT. A person was stabbed in the thigh with a knife, resulting in a wound measuring 1 centimeter in length and 3 centimeter in depth. How would you classify this wound? Answer is penetrating wound. It occurs when a sharp object breaches the skin and enters deeper tissues without exiting the body, and it is characterized by greater depth than length. And clinical features: risk of internal damage to muscles, blood vessels, or nerves, and it requires evaluation for bleeding control, infection prevention, and potential surgical repair. Next question from PSM. A study initiated in 2012 at Delhi University with 5,000 to 6,000 individuals aimed to evaluate the role of physical activity on cardiovascular diseases with outcomes assessed in 2024. What type of study does this represent? So this is a case of prospective cohort study. The different types of studies and how to identify them again is a favorite question. So a prospective cohort study follows the participants forward in time from exposure to outcome. Next question from pharmacology. A diabetic patient with congestive heart failure presents with pedal edema. Which medication is preferred in the setting of combined cardiac and renal failure? Answer is SGL2 inhibitor. So SGL2 inhibitors like empagliflozin, dapagliflozin, they block the glucose reabsorption in renal tubules, promoting glycosuria. It is demonstrates cardioprotective and nephrotoxic effects. It lowers the BP and induces weight loss via caloric excretion. Next question from FMT. During court proceedings, a defense lawyer asks a leading question which the prosecutor appeals against. The judge grants the appeal. In which of the following are leading questions permitted? Answer is cross examination. So section 141 of the Indian Evidence Act defines a leading question as one that suggests the desired answer. So it is permitted only during cross examination to challenge witness credibility or uncover inconsistencies. So it is not allowed in the other examination, in chief, re-examination, or even in case of dying declaration. Next question from anatomy. The lymph nodes located at the site indicated by the arrow are classified under which level? So answer here is level 2 because it belongs to the upper jugular group situated between the skull base and the hyoid bone. Again, the levels of lymph nodes and is again a very important question. Please learn about it. Next, the RNA molecule contains the coding sequences 5-AA, CA, CC, AC, 3-. What will be the corresponding DNA sequence in the template strand from which it was transcribed? So the answer here will be 3-, TT, GT, GG, TG, TG, 5-. The template DNA strand is complementary to the RNA sequence and is anti-parallel, that is opposite directionality, and the RNA sequence provided here and the template DNA strand is 3-TT, GT, GG, TG, TG, 5-. So T replaces uracil and strands run anti-parallel. Next question from microbiology. A farmer working in a paddy field presents with fever, muscle pain, nausea and vomiting. Microscopic agglutination test was positive. Diagnosis is leptospirosis. It is caused by Leptospira interrogans, a spirochete transmitted through contact with contaminated water or soil. Microscopic agglutination test is the gold standard for the diagnosis, detecting antibodies against Leptospira. The clinical features are fever, calf muscle pain, conjunctival suffusion and jaundice. Exposure history. That is, it is commonly seen in farmers or sewage workers. Next question from anatomy. A patient presents with hypopigmented patch behind the ear and loss of sensation. Neck examination reveals a thickened structure. What is this structure? Answer is greater auricular nerve. Hypopigmented patch plus sensory loss suggests leprosy, which is also known as Hansen's disease. It commonly affects the peripheral nerves. The greater auricular nerve with C2, C3 is frequently thickened in tuberculoid leprosy due to the granulomatous inflammation. Next question. Which electrolyte abnormality will lead to cardiac arrhythmia in the case of severe vomiting? Answer is hypokalemia. So severe vomiting causes loss of gastric HCl leading to metabolic alkalosis and hypochloremia. Renal compensation via aldosterone increases the sodium reabsorption in exchange for potassium and H plus excretion, worsening the hypokalemia. Paradoxical aciduria occurs as the kidney excrete H plus to correct alkalosis, further depleting the potassium. Next question from pediatrics. What is the most appropriate diagnosis for a 3-month-old child presenting with cold, cough and rapid breathing, respiratory rate of 58 per minute, but no chest indrawing or danger sites according to IMNCI guidelines? Answer is pneumonia. So fast breathing with respiratory rate more than or equal to 50 per minute in infants 2 to 12 months without chest indrawing or danger signs defines a case of pneumonia, and severe pneumonia requires either chest indrawing or danger signs like inability to drink or convulsions. So management for normal pneumonia case is it is treated with oral amoxicillin at home. No hospitalization is required. Respiratory rate of 58 per minute exceeds the threshold for this age group. Next question from FMT. A doctor receives simultaneous summons from criminal and civil codes. What is the appropriate course of action? Attend the summons for the criminal case, because criminal cases take precedence over civil cases when summons conflict, as they involve public interest and potential penalties. Example like imprisonment. So higher courts also supersede lower courts, but here both are of equal status. Failure to comply with the criminal summons may lead to penalties under IPC section 174 or BNS 208 for non-attendance. The doctor must formally inform the civil court of the conflict and seek rescheduling. Next question from pediatrics. A newborn with respiratory distress is found to have a posterolateral diaphragmatic defect on CT imaging. What is the most likely diagnosis? Again, types of hernia is a very important question. Here the answer is Bush-Dalek hernia, which results from congenital failure of pleuroperitoneal membrane closure, left-sided in 85% cases, allowing abdominal organs like intestine or liver to herniate into the thorax, causes lung hypoplasia and respiratory distress due to compression of developing lungs. Next question from pediatrics. A child presents with micrognathia and low-set ears. These clinical features are commonly associated with which type of genetic abnormality? Answer is deletion. So micrognathia and low-set ears are a hallmark feature of Credouchat syndrome, which is caused by a deletion in chromosome 5p. 5p 15.2. The deletion disrupts the genes critical for craniofacial and neurological development, leading to the characteristic cat-like cry, intellectual disability, and dysmorphic features. High-pitched cry, hypertelorism, and developmental delay also support the diagnosis here, and it is confirmed by karyotyping or FISH to detect the 5p deletion seen in Credouchat syndrome. Next question is from biochemistry. Which enzyme is responsible for the removal of triglycerides from chylomicron? Answer is lipoprotein lipase, which is activated by ApoC2 on capillary endothelium, hydrolyzes the chylomicron triglycerides into free fatty acids and glycerol for tissue uptake or storage. It is critical for clearing the dietary lipids from circulation post-meal. Next question from biochemistry. A 25-year-old male with Plasmodium vivax malaria and a family history of hemolytic anemia among male members requires which test before starting anti-malarial treatment? Answer is G6PD level, because it is an excellent condition and it causes oxidative hemolysis when exposed to primaquine, which is used for Plasmodium vivax radical cure. Testing prevents the life-threatening hemolytic anemia in susceptible individuals. Next question from pharmacology. A schizophrenia patient discontinued olanzapine therapy despite symptom control. Most likely reason is weight gain. Olanzapine's 5-HT2A receptor blockade disrupts the hypothalamic regulation of appetite or metabolism, leading to hyperphagia and insulin resistance. The strongest association with metabolic syndrome among atypical antipsychotics is seen here. Next question from PSM. A patient from Delhi presents with fever, arthralgia, extensive petechial rash, thrombocytopenia with platelets of 20,000 cells per mm cube, prolonged bleeding time and normal clotting time. Most likely diagnosis is dengue. So dengue virus, the flavivirus, causes endothelial dysfunction and bone marrow suppression, leading to thrombocytopenia and plasma leakage. Petechial rash results from capillary fragility and thrombocytopenia. So there will be a triad of fever, arthralgia and rash seen here. Thrombocytopenia and prolonged bleeding time will be also seen, and leukopenia will be also present. Next, a 3-year-old boy has a height of 90 cm and lower segment of 45 cm during routine anthropometric surveillance. Most likely diagnosis is spondyloepiphyseal dysplasia. So anthropometric metrical diagnosis by upper by lower segment ratio equal to 1, which is abnormal for age, and normal at 3 years is 1.3. It indicates disproportionate short stature with truncal shortening, and type 2 collagen defect impairs the endochondral ossification, causing short trunk, kyphosis and barrel-shaped chest. Limbs appear relatively long compared to the trunk. Next question from pediatrics. A neonate presents with bilateral chorioretinitis, intraparenchymal calcifications and hydrocephalus. What is the causative organism? Answer is Toxoplasma gondii. So the pathognomonic triad here is chorioretinitis, hydrocephalus and intraparenchymal calcifications, which are classical for congenital toxoplasmosis. It is caused by transplacental transmission of Toxoplasma gondii, and diagnosis is by IgM anti-toxoplasma antibodies, ISAGA or IgA ELISA for confirmation. Next question from pathology. In which of the following condition is alpha-fetoprotein typically elevated as a tumor marker? It is seen in case of hepatoma. Again, a direct question, don't make it wrong. AFP is a glycoprotein produced by fetal liver and yolk sac, re-expressed in hepatocellular carcinoma and also certain germ cell tumors. If the levels are more than 200 nanogram per ml, it strongly suggests hepatocellular carcinoma, especially in high-risk patients, that is patients with cirrhosis or chronic hepatitis B or C. It is used for clinical for screening in cirrhotic patients and monitoring treatment response. Also, it is elevated in yolk sac tumors, which is a germ cell tumor subtype. Next question from anatomy. A primea gravida delivers a baby with severe cranial and spinal defect. Most likely diagnosis is open neural tube defect. So cranioraschisis results from complete failure of neural tube closure, exposing both the brain and cephali and spinal cord rachis, caused by defective primary neurulation in embryonic week of 3 to 4. Next question from pharmacology. Resistance to which antitubercular drug occurs because of mutation in CATG gene? Answer is isoniazid. It requires activation by CATG to inhibit mycolic acid synthesis in Mycobacterium TB. Mutation in CATG impairs the drug activation, causing high level INH resistance, which is the most common mechanism. Next question from PSM. Which of the following is not a food adulteration related disease? Answer fluorosis. It is caused by excessive fluoride in drinking water, that is 3 to 5 mg per liter, not because of food adulteration. It manifests as dental mottling, skeletal deformities, example genovalgum, or crippling fluorosis in higher exposure to fluoride, and it is endemic in regions with high groundwater fluoride like Nalgonda, Punjab, etc. Next question from pediatrics. A child with fused carpal bones is diagnosed with hand-foot syndrome. Which gene is associated with this condition? Answer HOXA13. It is a homeobox gene critical for limb and genital involvement during embryogenesis. Mutation cause hand-foot genital syndrome, characterized by fused carpal bones, short thumbs, and urogenital abnormalities. The clinical features are: it is an autosomal dominant inherited condition with variable expressivity, and there will be syndactyly, hypoplastic nails, and uterine malformations, example biconjugate uterus, which can be seen here. Next question from FMT. A body brought for autopsy was cold, had rigor mortis in all limbs, and showed livor mortis on the back without putrefaction. What is the estimated time since death? Answer 6 to 12 hours, because rigor mortis begins 2 to 4 hours post death, fully develops by 6 to 12 hours, and resolves by 24 to 36 weeks. Presence in all limbs suggests early to mid phase. So again, livor mortis, which is fixed non-blanching, is by 6 to 12 hours, consistent with dependent lividity on the back, and no putrefaction rules out that it is more than 24 hours, because putrefaction typically starts at 18 to 36 hours. Next question, the last question of this video. A 50-year-old woman with breast carcinoma develops hair loss 3 weeks after starting chemotherapy. What is this pattern of hair loss called? Answer is anagen effluvium. Also, please read about telogen effluvium, because they both are similar conditions, but they have a difference also. So understand what is the difference between anagen effluvium and telogen effluvium. It's a homework for you guys. So chemotherapy targets rapidly dividing cells, disrupting the anagen, that is the growth phase of hair follicles, leading to abrupt hair shaft breakage. And common culprits for anagen effluvium are taxanes, paclitaxel, anthracyclines like doxorubicin, and alkylating agents like cyclophosphamide. So that's it guys for this video. Till I come back with my new video, stay tuned. And if you guys are interested to buy my Neetpg 7 years complete PYQ book, then you can buy it at a very nominal price through the link provided in the description. So that's it. I'll come back soon with the next set of questions. Till then, bye.